and go live and bring in the stakeholders. Good morning, everyone. Welcome to the Public Health and Minority Health Disparities Subcommittee. We are considering the House and Senate versions of one bill. This is House Bill 288, Senate Bill 299, Grocery Stores and Restaurants Automated External Defibrillator Program. We are working from the Senate bill. I just want to confirm that, Delegate Collison, Vice Chair. We're working from the Senate bill, and just this is a priority of the Senate. It's a priority of our chair. Our vice chair has been working with stakeholders. My understanding is we have put some limits around the bill. Everyone's not necessarily happy, but we think we have a bill that will work for everyone. And knowing that we have to get it back to the Senate because we're amending their version. I'm going to ask Aaron to walk through the bill, the reprint, and then Vice Chair Collison, if you can speak to the work that you've done, and then we'll hear from anyone who wants to be heard on this bill. So Aaron, go ahead and walk us through the bill.
Okay, you have a reprint of the bill.
Sorry, Delegate Hill, the bill number is Senate Bill 299, House Bill 288, and we're working from the Senate Bill 299. Sorry, go ahead, Ms. Hopwood.
Okay, you have a reprint on the bill. Page 2 pulls in current law, starting on line 8, and this is the automated external defibrillator program that is run by MIMS. If you look on lines 29, this would exempt the facilities that are the grocery stores and the restaurants that are subject to the bill from the current AED program. Moving on to page 3, starting on line 22, this is new law under the bill that defines an AED. And then if you move down to bill page 4, line 7, this defines a grocery store as meaning a store that has all major food departments, including produce, meat, seafood, dairy, and canned and packaged goods, or at least one of the major food departments, and at least 12,000 square feet of floor space. Starting on line 13, it provides that the bill would not apply to a grocery store that has an annual gross income of $10 million or less, or a restaurant with an annual gross income of $1 million or less, exclusive of sales for off-premises consumption, or a seating capacity of less than 100 individuals. Starting on line 16, the bill provides that beginning January 1st, 2025, each owner and operator of a grocery store or restaurant shall place an AED in a prominent area accessible to employees and customers and maintain the functionality of the AED. Then starting on line 24, this provides for some immunity provisions, specifically that a grocery store or restaurant is not civilly liable for any act or omission in the provision of AED if the grocery store or restaurant has satisfied the requirements of this section. And then it also provides that an individual is not civilly liable for any act or omission if the individual is acting in good faith while rendering AED to another individual who is a victim or reasonably believed by the individual to be a victim of sudden cardiac arrest. The assistance or aid is provided in a reasonably prudent manner, and the AED is provided without fee or other compensation. It further provides the grocery store, restaurant, or individual is not civilly liable for failing to render AED to an individual who is a victim or is reasonably believed to be a victim of sudden cardiac arrest. Then starting on line 15, this requires MDH and MIMS to jointly adopt regulations that establish guidelines for periodic inspections and annual maintenance of the AED, assist the owner and operator of a grocery store or restaurant in carrying out the provisions of the section, and require each grocery store and restaurant subject to the section to register with MIMS in order to make its location publicly available to emergency dispatchers and receive maintenance and recall notices from MIMS.
Thank you, Aaron. Vice Chair Collison, go ahead and talk to us about the work, and then we'll have a motion on the amendments and open it up for discussion.
Thank you very much, Madam Chair. And I want to thank the subcommittee, but I also want to thank the restaurants and the grocery stores for working with us on this. I understand the resistance to these kinds of mandates. It's not just these entities. We've experienced it anytime we try to make a mandate on virtually any entity. It's, we like to be autonomous and independent, but this is something that we think is important, that we've worked on for a number of years, because it's really a precautionary measure, a preventive measure. And what we are being told is that it doesn't happen very often and in restaurants and grocery stores. So, why are they being singled out? Well, in fact, with the exception of living spaces, like homes, apartments, and long-term care facilities, it does happen periodically in restaurants and grocery stores more than it does in other places. Like the study that MIMS did in 2017, it happens a lot more often in restaurants. There were 64 incidences in restaurants in that same time period. There was one at a swimming pool in that same time period. So that's 54 people who had a sudden cardiac arrest in a restaurant over 3 years. Now, not a high incidence, I agree. But if those 64 people, I don't know what the outcome was of those incidences. I hope that those folks are still with us, but the research shows that if they are not treated immediately, anytime after 4 minutes, there's real danger of death and brain damage. So the AED, which we saw in the during the hearing, is extremely easy to use. It cannot be misused, because if it is not being done correctly, it will stop. So, we know, and the liability language is there to protect against anything else. So what I worked on with the stakeholders was, we didn't want to put an undue burden on the smaller entities. Now, it is true for restaurants, but with the passage of another bill, there is a $500 tax credit that if they purchase an AED. So that's that's an advantage that they have. And these machines run between $500 and $1,200, with the average being about $800. So if we take out the small restaurants with low gross revenues, under $1 million, we feel like we're not burdening them. In terms of the grocery stores, same issue. Try to not put additional burdens on our smaller stores. And the numbers of 12,000 square feet and $10 million are from the research that Kaylee Locklear did with their smaller stores to find out, where the sweet spot was, actually, to make sure that the mandate would apply to basically the much larger stores and chains and would catch them. So I think that we've tried, and the restaurants gave us the language around the seating of 100 and the off-premises sales, so that the gross revenue figure only applies to on-premises eating. And so with that, Madam Chair, I feel like we've tried to accommodate them to the degree that we can, and I'd offer these amendments to the subcommittee. Thank you.
Move the amendment.
Can I get a second?
Second.
Thank you. All right, so the amendments have been moved and seconded. We're going to open it up to discussion. Let me start with the members, and then Melvin, I'll come to you as well. sorry, I didn't see the order. Let me start with Delegate White.
Thank you, Madam Chair. My question as it relates to the amendments here, about how many stores would this apply to? So how many would be exempt? So I'm just trying to get an understanding of where the AEDs wouldn't be. Do we have a sense of what that number translates to about roughly?
I don't. Mr. Thompson might actually have that number, but I believe the original 400,000, you remember the bill came in with a 400,000, and that was going to eliminate about 3,000 restaurants. But you know, with $1 million, I think we hit a higher number.
Thank you. Delegate Martinez.
Thank you, Madam Chair. And thank you everyone for the work on this bill. Many of you know I'm one of the newest members of the legislature, so there hasn't been too many things my constituents or business owners and community have brought up of concern, but this bill in particular was one that many of my mom and pop restaurants around the Route 1, like Arts District area in Hyattsville and some other areas have brought up of real concern, just because we've seen a lot of the issues and mandates that are brought up with restaurants in particular and how hard it is for them to stay in business. I do like some of the amendments. I think, you know, I appreciate all the work that was done to kind of mitigate any of those concerns. But can you describe or discuss how the calculation of off sales versus on sales is going to be? Like, how is that done and who's managing that to determine who has to comply and who doesn't?
Madam
Vice
Chair?
Chair, I was going to say, do you want to
Mr.
answer this, or is Mr. Thompson? Mr. Thompson, if you could address that.
Yes, thank you very much. And I appreciate the question, Delegate. And we put that language specific to sales for on-premises consumption because that's what we're really talking about here with regard to this mandate for on-premise dining customers. And restaurants do track the amount of their sales that are off-premise through their point of sale systems. And so when we're talking about off-premise sales, that includes both carry out and also delivery. And so it is very easy through the point of sale system for restaurants to know the ratio of off-premise versus on-premise sales.
And I understand the POS can do that, but is there an agency or entity that's like tracking or keeping up? Will they have to report to with that information? I'm just trying to figure out who in my district I need to say, hey, this is something that you need to make sure you have versus other folks that might be exempt.
No, sir, there is no agency that tracks that, but compliance would be handled between both MIMS and the health department, which sends inspectors into restaurants on a periodic basis, and they would be checking for compliance on this. And so if there's a question regarding the documentation that qualifies them for the exemption, they could request that documentation from the restaurant's POS system.
Perfect. Thank you so much, Madam Chair.
Thank you. Delegate Lewis.
Thank you, Madam Chair. Thank you, Madam Vice Chair Cullison, for all the work on this. I'm curious to, I just would like to understand how small businesses, the restaurants under 100 tables, the grocery stores under 12,000 square feet, how they might also benefit from the tax credit. They're exempt from the provisions of this bill. However, if they wish to, and they are able to purchase an AED, can they also benefit from that tax credit?
This, the grocery stores can. The bill that we passed is specific to grocery stores. I think if we proceed with this kind of mandate, we may want to consider opening that up to the grocery stores next year in the next session, but it didn't come through this session.
Right, but thank you, Madam Vice Chair. But
Yeah.
if those grocery stores that are exempt from this bill, they don't meet the terms in the bill, but they have an extra $800 to purchase an AED. They won't get the tax credit? Is that my understanding?
Not a grocery store. The tax credit doesn't apply to the grocery stores, but
But
a
to the
small
restaurant,
right, but a small restaurant, absolutely.
they
They
still
can,
can, even if they
yes,
are, okay. Thank you very much.
yes,
I just wanted to be clear. Thank you.
yes.
Thank you, Madam
Mhm.
Chair.
Thank you. Delegate Alston.
Good morning. I definitely appreciate all the effort that everyone has made into this bill, but I must say that I have major concerns about the exclusion related to grocery stores. In my district, we have a massive problem with access to healthcare as well as grocery stores. They're limited in numbers, so we have an overpopulation of people that shop at the same places. And it's difficult for them to get to an actual hospital based on the location. And we really need to have these machines in the grocery stores. And to say that a grocery store making under $10 million is now going to be exempt, I just don't find it acceptable. These machines are very inexpensive. I mean, and they're a business expense. If we mandate it as a state, it's a business expense. They can write it off on their taxes as such. And I just do not believe we should be exempting grocery stores that are making all of this money, especially in neighborhoods where we have massive healthcare disparities, like the ones that I represent. And I just don't agree with that. I think that all of the stores need to have the machines. It probably needs to go even further. But to exempt a grocery store that's making upward of $10 million a year is really unacceptable. And I just do not believe that we should be doing that, knowing all of the healthcare disparities that take place, especially in my district, in the 24th district, where we have grocery store problems and hospital problems. Thank you.
And Vice Chair, do you want to respond?
If I may, Delegate Alston, I absolutely understand, appreciate, and agree with your sentiment, but it's difficult for us to make, large scale mandates that, do affect businesses. And we want to make sure that we are as judicious as possible. And as you know, the legislative process, sometimes we have to take steps. And, I'm willing to work with you next year on how we begin to have a bigger coverage. We can work over the intercession in terms of how we might reach out to, particularly, areas where where there might be a higher need would have greater access to these kinds of things. And I think that the $10 million is gross. So that means all of their sales in the grocery store. So it's not profit. It's what they got. So my understanding is the profit margin in these stores is about 3%, somewhere between 1.5 to 3%. So in terms of the actual profit, it's not very high, even though the gross sales might be $10 million. It's a great sentiment. Love to work on it, but this is like one step forward.
If I could, if I could just ask a question, where did the 10 million number and the 12,000 square foot come from? Because in my areas where we have food deserts, that's going to exempt pretty much all of the stores where people buy their groceries. And in the larger areas, they are, they're overpopulated with people because we just don't have enough grocery stores. And for a variety of reasons, we haven't been able to get them. So at those numbers, I'm afraid that all of the stores, in my district where the poorest people live and where the people who have the most heart problems are going to be shopping, won't have access to this life-saving equipment.
Madam Chair?
Go ahead.
Those numbers came from an analysis of the retailers did a survey to look at what the average gross receipts were for grocery stores and what the size was of the smaller grocery stores. Again, I asked them to come with a bright line, since it was they were worried mostly about their smaller stores. What was the bright line defining it? And they said 12,000. We came in with 10,000 square feet. So I thought it wasn't that much of a difference. The $10 million is really in the average range of gross receipts between the smallest grocer and the largest, smallest grocer, if you know what I mean. Thank you, Madam Chair.
You're welcome.
Thank you. And I don't want to I appreciate the leeway, Madam Chair, but I do want to say, I'm definitely going to support the bill, but I would like some leeway. I'm going to check the stores in my district. And if I find that they're being exempt, I'm going to ask for an amendment on this and really fight for it and push for it, because I just don't see, even if this machine was $2,500, it's just not a lot of money for a business to put out to save the lives of their customers that are spending at least that amount of money. This is just not a lot. I know I personally, as a business owner, spent way more than that on fees and equipment and training. And I just know that these businesses can afford it. They just don't want to do it. And I think this is one of those times where we as the legislator just need to say, you have to do this. And the sky is not going to fall down. They're not going to go out of business. We're saying $500 to $1,000. That is not going to put one of these stores out of business. They can totally afford to do it. They just don't want to. And I just think we need to tell them that they have to do it. So I appreciate the back and forth. Thank you.
And I really appreciate your sentiment and your advocacy, particularly for your district. Just very respectfully, bearing in mind that we have a time constraint and we have other opportunities that we can continue to work on this issue. We can look at expanding that tax credit. We can to grocery stores. We can look at if there is, to your point, if we are not addressing some of our food deserts or some of our healthcare deserts with this. This is in our possession. It's not an ECM, which means that we have the ability to look at how we can expand this. So I appreciate, I also appreciate that back and forth. And I encourage you to talk offline with the vice chair as well about next steps. Delegate Hill.
Thank you, Madam Chair, and I appreciate the discussion and particularly Delegate Austin's concerns. And so I guess it's really two questions. Number one, I'm looking for this 21303.3, and I can find 21303.1 and 0.2, which have to do with cottage food industries. I can't find this 0.3, and I don't have a sign in for Westlaw. So I'd appreciate it if Aaron could explain that. I'd also like to ask Mr. Thompson, the sweet spot is how Bonnie described that 10 million sweet spot for what? Is that 50-50? I mean, what was that line separating people who can afford $500 and people who can't? I don't understand what the sweet spot was. So I'd like to know that. And then who are we talking about when we say more and less than 100? I mean, I can imagine that most of the restaurants that are, Chipotle and McDonald's are excluded, and I get that. I'm not sure what 100 seat capacity restaurants. I mean, right, a Ruth Chris clear with upstairs and downstairs clearly has more. I'm just trying to get a sense of where these divisions fall.
Okay, so let me start with Aaron, and then we'll go to Mr. Thompson, and then to Vice Chair Coulson.
You can't find 0.3 because that's the new section that's added by the bill. So in the bill, that's 0.3. So it's referring to the new law.
Oh, you're on mute, Delegate Hill.
Sorry, and they're exempted from 0.3, and what is it exempting them from? I'm confused.
So am I on mute or am I not?
You're good.
It's exempting them from the MIMS current AED program, which is the training for people that for facilities that have AED.
Okay, So since the AEDs are they're automated, they run themselves, and they tell you what to do. No one needs to be trained, they just have to maintain them. Okay,
That is the rationale. Correct.
okay.
And Mr. Thompson, if you could speak to that sort of sweet spot and who we would be looking at with the 100 individuals capacity.
Yes, ma'am, and thank you very much, Delegate Hill, for that question. We did look at data from the U.S. Census Bureau to determine what percentage of restaurants would be subject to the mandate based on the $1 million gross income threshold. And we found that about 39% of Maryland's 11,000 restaurants, or about 4,300, would be subject to this bill because they have gross income over $1 million. And on the seating threshold, I did have a question about that because this amendment language does not address specifically what we had requested for that exemption to apply only to the calculation of seating for indoor seats. And the reason for that is because some restaurants have outdoor seating, which is seasonal as the weather permits, and it can also fluctuate. And so we wanted to make sure that that exemption would apply only to indoor seating capacity. And so that's question number one. But you're right, Delegate Hill, a Ruth's Chris, which you used in the example, larger restaurants like that would be subject to the mandate if they had over the sales exemption and also over 100 seats. So we're not talking about the smaller restaurants. And generally in our industry, 100 seats is a common threshold for determining larger restaurants.
And if I may, Madam Chair.
Yes, go ahead.
Thank you, Mr. Thompson. So again, so your division is 39% of the rest of the grocery stores. No, the businesses would be, restaurants would be subject to this, and the other, 61 would not. But why was that the cutoff? What was the divide? What were you trying to do? Determine who could or could not afford a $500? I mean, what were you trying to distinguish? What was the criteria?
Yes, ma'am. And it is generally in our industry, restaurants that have over $1 million in gross that are considered to be medium or larger size restaurants. And our intent was to exempt the smaller restaurant businesses. And because of the narrow profit margin, which averages about 4% in our industry, Delegate, we wanted to make sure that this wouldn't be too much of a burden on those smaller operators, because even if you're doing over $1 million in gross income, you still have a very narrow profit margin. And so we were trying to protect those smaller operators because cash flow remains an issue despite the separate tax credit bill.
And if I may, Mr. Thompson, when we did this bill 2 years ago, or maybe it was a year ago, the Restaurant Association, if I remember correctly, was supposed to come back with whether or not there was a way that you all as an association had funding or something to supplement smaller or to help provide these, or could buy them in bulk and get some savings. Did you all ever finish determining if you could get bulk savings and buy them as an association?
That is a good question. We did talk to a local supplier of those types of devices to try to establish some program where our restaurants could benefit from that. We didn't continue those discussions because, as you remember, the last time your committee considered this bill, it was revised into a study for MIMS to come back and report on the locations that would be appropriate for AED devices and the incidence of AEDs. And so because of that study, we didn't pursue that. This is the first time we've seen the legislation since that study, but we can certainly work with any local supplier to see if we can get better pricing for our members.
All right, thank you. And I guess, again, that's something we can come back to, because 39% seems like an awfully small catchment area. That seems very arbitrary to to go with that division. Thank you very much.
Thank you, Delegate Hill. Delegate Chisholm.
Thank you, Madam Chair. This is one of those odd bills where I think everybody's in agreement that these pieces of equipment are vitally important. Obviously, I've seen them go to work myself in my own business and actually save somebody's life. The question is whether or not we should be mandating them. I would encourage every restaurant and every business to have one of these, but I'm not in favor of this broad sweeping mandate. If I could wave a magic wand and make sure everyone had one, I would, and make sure everybody's trained to use them because I think they do save lives. I was happy with our approach of doing a study and finding out how many people fell in, because if I remember from that one report, restaurants were like the number 27 on the list of places to have cardiac arrest. I know that BWI was number 1, they're like 7 times higher. And I know that they do have AEDs. So I just wanted to make the point, look, I think this is a very important piece of legislation, but I can't support a mandate because of the broad sweeping effects. If I could, and to Delegate Alston, if they end up sweeping some of these grocery stores in, I promise you, I'll be the first one to support your tax credit to help these small businesses out if they need the money to buy them, because it is very inexpensive. I just feel like to mandate it is not the right approach. I wish we had more data from the study. I don't know where that study is. I thought we just passed that in our House bill, but HB 288. But the Senate bill is the only bill, if I recall, that has an actual mandate. So I just wanted to put those comments on record. I love the idea. I just do not like the mandate. Thank you, Madam Chair.
Thank you, Delegate. And Delegate Riley.
Thank you, Madam Chair. I'll kind of piggyback on what Delegate Chisholm said, with the mandate portion. If we're going to mandate it, I feel that then the state should, pay for it in that respect. But I do have some questions if it's in the bill or not. First of all, what is the lifespan of these AEDs? And when, how often would they have to be replaced? Does it last 6 months or a year or 5 years? I don't know. Will these actually, the time span that they're actually in the location, do they have to be inspected? If so, who is going to do the inspection? Who is going to train the folks to be able to use them? So is that going to be on the business owner's expense as well to come up and, hire trainers to come in to train the staff, and who has to be trained? Let's see, what else I had down here. And you said something about, I know the Vice Chair had mentioned something about they would have to let everybody know where they are currently or something or another. We have one here in the legislature somewhere. I have no idea where it is. So I don't know, are we under the same guidelines of what these businesses are going to be under to make sure that everybody knows, the customers and the employees know where they're located? So whomever is best to answer those questions, I would appreciate it.
All right, Delegate Riley, I'm going to turn it over to Delegate Cullison, Vice Chair Cullison. But just a reminding, the training isn't required because they are automated, and that was actually the exemption that we provided so that it didn't become overly burdensome with requiring training of every staff member. And I'm going to turn it over to the Vice Chair to answer your other questions.
Sure. Thank you.
In terms of the life of the machines, I actually don't have that data. So, and I apologize that I can try to get that for you in short order. And as the chair just said, the training is not there because it's not necessary. But by including them in the these businesses in the PAD program for MIMS, it means that MIMS will know the machine is there, so that when an emergency is called to that business, they will know that there is an AED on site, and and make sure that it's being accessed. In terms of acknowledging where it is, that would be just a public information in terms of there's an AED in this facility, and it's located in the the secondary dining room or something. I don't know exactly how that would work, but again, MIMS would know where it is, but in terms of the public, just letting the public know, certainly all of the staff would know where it is. Just they would inform the staff. But the staff is not responsible for necessarily using it, and it can be a patron who is using it. There's no requirement on the staff. That's the liability clause. There's no requirement that they use it. So it's, we hope that they will, given how simple it is, but we've made no mandate on them to actually use the machine, but to have it available so that someone can use it. Does that cover all your questions?
Inspection, is that long?
That's part of MIMS, and they'll check it out. Right.
Okay.
And Vice Chair, if you're willing to defer, Delegate Chisholm actually has some answers on the longevity question.
Sure.
Because they use these this equipment in the gym, I believe.
So there's two different battery packs that come with them. The first one, you have the option of either a 5-year battery pack, and that 5-year battery pack, as long as it's been up on the wall for 5 years, then it's still in good use, and it'll alert you to change the batteries out at that time. So you keep the same piece of equipment, you just change the battery. There's also another one that's a 7-year, and once it gets started, the battery's strong enough for that actual defibrillator to go for 17 straight hours. So the lifespan of the actual units can be a long time, but the initial is always at least 5 years on the battery pack. And as far as the training goes, I do know that in my business, when we get our CPR training, AED is usually included with it. And a lot of these restaurants, and I'm sure Mr. Thompson can answer this as well, most of them go through CPR training as well. And it's kind of just an add-on because you are doing CPR almost the same simultaneously as the AED, and it can walk you through both. Hope that helps.
Yes, it does. Thank you very much, both of you. Oh.
Delegate Rosenberg.
Is there some way to add some uncodified language that would provide for a review of how moving the bill as the substance as draft, as amended, proposed to be amended, but adding uncodified language that would mandate a review of the impact of this and further study perhaps of some of the unresolved issues? What I'm proposing is keep the heart of the bill, don't change that as it's proposed to be amended, but at least make it clear that we're not done with this issue and need more information. That's my suggestion.
Aaron?
I was going to say, I would certainly be open to that.
Thank you, Vice Chair. Aaron, could we look at uncodified language? I know we're resisting uncodified language, but could we look at potentially, language that makes it clear that we're going to continue to study the issue, that we're not complete?
Who would do the review is my question though.
Would that be MIMS or the health
MIMS.
department?
And if you're asking them to do the review, I think they should be consulted as well.
Who's enforcing this? If I may, I'm sorry.
Well, MIMS would know where they're located.
Madam Chair,
MIM should look back at it. They should ask the same questions again. How many incidents, blah, blah, blah.
Delegate Lewis, Delegate Lewis, did you want to be heard on this question?
The restaurant associations can give us information too.
Mr. Thompson?
We did not discuss within our legislative committee any type of tracking, but I know that when you register with an AED device through MIMS, that also requires you to report any cardiac arrest incidents. And so they will have that reporting information. As it relates to any further study, that would be a question for MIMS. And I think I did see Pat Gaynor from MIMS on, so you might be able to recognize her. Madam Chair.
Yes, thank you very much. Pat Gaynor, do you want to speak to this question?
Yes, good morning. Good morning, everybody. MIMS has been operating the statewide AED program for 20 years. It's been a big success. Over 9,000 entities, 15,000 AEDs. We're happy to work with the committee moving forward. We're happy the committee is going to include the registration, which allows 911 centers to know where the AEDs are and will permit some follow-up. And otherwise, you would never know if there was no registration requirement, actually who's complying with the requirements of the bill. One thing we wish there were training required in the bill. CPR is part of this. The legislature passed a mandate in 2016 requiring all high school students to be trained in CPR. AEDs don't always work. You need to know CPR, but I understand there's not a lot of sentiment for that right now. But we're happy to work with everybody moving forward. If there's follow-up needed, we're happy to work with the Restaurant Association and stakeholders to help things along.
And am I hearing that you would not be resistant to a review process and being a part of that review process if we amended that into this bill?
That's correct. That's correct.
Thank you. Thank you very much.
Thank you.
So we have a motion. I'm going to go to Delegate Hutchinson, and then we're going to circle back because I think we need to potentially amend the amendment. So,
thank you, Madam Chair. When we first heard the bill, I know the Retail Association, as well as the Restaurant Association, were not in favor of the bill. I recall getting a letter the other day from Mr. Thompson, but it still was unclear whether the amendments changed their position. Do we know where both associations stand now with the amendments?
Mr. Thompson, do you want to speak for the Restaurant Association? And then,
Yes, ma'am. Thank you, Madam Chair. And thank you, Delegate Hutchinson, for the question. We are officially still opposed to the bill, but we sincerely appreciate Vice Chair Cullison working with us on these amendments to mitigate the impact of the bill on our industry. And so, if it is the will of this committee to pass the bill, then we would appreciate these mitigating amendments.
Thank you, Mr. Thompson. I don't think we have the Retail Association, but Vice Chair, I'm not going to ask you to speak for them, but if you can just speak to the work you were doing together.
My impression from my last conversation with Ms. Locklear was, with the adoption of the $10 million and the 12,000, that they would be neutral, and but they were happy to see those amendments.
Thank you. Thank you. And I know we've got a couple of folks that want a second bite at the apple. Let's go ahead and address first, Delegate Rosenberg. Do you want to offer a motion to amend the amendment?
Yes, I do. I would propose that there be uncodified language to review the impact of the bill, the number of incidents, if that's reasonable, but also one aspect of the review to be done by MIMS would be evaluating potential expansion of the program, MIMS in cooperation with the affected private sector industries. If that's an outline.
Do we have a second?
Second.
All right, and can we support these amendments in concept, knowing that Aaron's going to refine the language?
Yes. Go to vote.
All right, so let's go ahead and vote on the amendments, including the amendment in concept. All in favor, please say aye.
Madam Chair, I just had a question about the indoor.
We're going to circle back
Okay.
to that in just one moment. All in favor, say aye.
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 Anyone opposed? Anyone opposed? Go ahead and raise your hand. This is just on the amendments.
Can I just ask one clarifying question?
Yes.
Report back to affected committees before next session?
Yes.
Okay.
Is that agreeable
Before
to?
next session? Is that
January
enough?
1st. I would say before January 1st, 2024.
Wait a minute, what are they reporting on?
The number registered.
So this goes into effect, so there's a number registered, I'm sorry, Aaron, I interrupted you.
Okay. Number registered, number of adverse events, and potential expansion. Now the bill, yeah, so yeah, that might not be.
Yeah,
I think
it would have
another
to
year.
be, yeah,
Yeah,
it would have to be another year.
Yeah, so January 1st, 2025.
thank you.
Yes, thank you. Thank you for the clarifying. I saw,
Or December 2024.
yeah, so that we have time to
Sure.
act on it.
Jan 1, 2024.
Delegate
Right,
Alston, I know
December
you
1.
had your hand up in opposition to the amendments. Is that correct?
That is correct. And the reason I'm opposing the amendment is based on my earlier statements. And it's subject to me looking at another amendment, and I'm not trying to slow things down. I know we need to get this moving, but
And I appreciate that. I just want to make sure we're recording.
yes, I'm
recording
opposed
accurately.
to the amendment that
The amendment.
reduces the number of grocery stores required to have the machine.
And thank you. And Delegate Rosenberg, Delegate Hill, were your hands still up for questions? Okay. Mr. Thompson, we want to go back to the question of the 100 person capacity. And I want to hear from you, and then I'm going to give the Vice Chair an opportunity to respond.
Thank you very much, Madam Chair. And that question is for Vice Chair Cullison, because in the language we had submitted regarding that, we had specified an indoor seating capacity of less than 100 individuals. And as I mentioned before, that's because some restaurants have outdoor seating on a seasonal basis, and that can fluctuate. And I think it would be challenging for enforcement to determine that threshold when you sometimes exceeded with outdoor seating as weather permits and sometimes you don't. So that's why we also wanted to specify indoor. Was that omitted intentionally, the word indoor, or was that simply an oversight, Vice Chair?
May I, Madam Chair?
Yes, absolutely.
Okay. It was omitted intentionally in my conversations with the chair. She felt that that the number of even though they're outdoor seating, they are still there in the restaurant eating and would have access to the AED. In terms of, if there's a way to, I would say that it's 100 seating capacity at any time. And that's, so it would capture the folks who had seasonal outdoor seating. If their indoor seating was less than 100, but in the summer or in Maryland, it can be as long as 4 months, it may be over 100, then they would, I think, be captured by the mandate.
Thank you for that clarification.
Thank you. And I now have questions from Delegate Hill, followed by Delegate White.
Thank you. So questions and comments. Just following up on cost of maintenance, the packs, which Delegate Chisholm referenced, battery packs and pads, because the pads can dry out after a while. About $300 is the low end of what I'm finding. So people have that information. So maybe that's $300 every 5 years or so. MIMS, just a question for you all. I think, your numbers are impressive. They just, compared to where, all of us know that most of the places we go don't have AEDs, although we're seeing more. And I was just going to ask you all to consider if there's budgeting for MIMS to do public service announcements, that you consider start doing public service announcements about the importance of it. So to Delegate Chisholm's points, we can maybe start persuading businesses and other entities that it's time to start having AEDs around and they can do it on their own. Question to Mr. Thompson, there was an issue of whether we put a tax credit, but again, this is a business expense, as Delegate Austin said. So can you answer, is as a business expense, is that not a write-off and explain what a difference a tax credit would or would not make, so that when we come back in a year or two, we understand if that's something we need to do. And then the final question is for the vice chair. Retailers, we said groceries. I'm just curious, not to change the bill, but why did we focus on groceries instead of retailers generally of that certain dollar gross income? Thank you.
All right, I've got to figure out where to start. Let me start with Pat Gaynor, and then we'll go to Mr. Thompson, then we'll go to Vice Chair.
And I apologize, I missed, for 2 seconds, I missed what was.
Do you all
directed at
have
me.
the capability, or would you all be open to at least considering and discussing whether you all can pay for some public service announcements and begin to promote the idea so that we can move towards having more AEDs in locations by voluntary methods instead of our having to mandate this kind of thing?
Yeah, absolutely. As you know, we're a state agency. We don't have a lot of money, but we certainly, public safety announcement, prevention is a big part of EMS, and we're happy to talk about how to move forward in that direction. Work with the American Heart Association, other stakeholders who have an interest in this.
Thank you. Mr. Thompson.
Yes, thank you very much. And just to clarify, the $500 tax credit separate bill that was passed for restaurants would be for only those restaurants that have gross annual income that exceeds $400,000 a year. And Delegate Hill, regarding the deductibility of any balance of the cost, you are correct. It would be a deductible business expense. However, that deductibility really depends on your tax bracket, how much of that you can deduct, as we understand it. And the other concern that we had, even despite that, is restaurants have issues sometimes because of our narrow profit margin with cash flow. And so that would still be a cash outlay for restaurants that have to purchase one of these devices despite the end of the year tax credit and the business deductibility of such expenses.
Right. And to be clear, deductibles mean that you actually have to have a profit, right? So
yes, that is correct.
It's not value if you don't really have a profit. Correct.
That was another point that our legislative committee did bring up. Thank you, Delegate Hill, for reminding me. You're absolutely correct.
And thank you for that. And just a reminder to the members, because I think Mr. Thompson is hearing that there is a desire to push industry, not to mandate, and so we're trying to find that balance. But this doesn't just affect the 100 people that are eating. This also could be the staff, the employees, because they're not actually in the calculus, but they are subject to heart attacks and to the trauma of witnessing somebody in cardiac distress. So I want to make sure that I'm giving a shout out also for the employees who are often forgotten in the equation. Delegate Cullison, Vice Chair Cullison, I think Terry had, Delegate Hill had an outstanding question. So if you could, you're on mute, Madam Vice Chair.
Thank you, Madam Chair. Yes, the question is why focus on grocery stores and not all retail? And the answer is we, again, are taking a step-by-step approach to this concept, and we figured everyone goes to a grocery store at some point in their lives. So it's the place where we know that people congregate and that and that everyone is going to access it. So that was why we chose grocery stores at this point.
Thank you, Madam Vice Chair. All right. For another bite at the apple, let's go to Delegate White.
Thank you so much. In the conversation, there was, we went back to seating capacity. I just wanted to inquire as it relates to seating capacity versus occupancy and the distinctions between the two of those. And if occupancy was ever considered here, like total occupancy, where there could be differences, that's all.
Vice Chair, do you want to speak that, or Mr. Thompson?
I think Mr. Thompson can answer that. It was the Restaurant Association's recommendation.
Thank you, Delia. That's a very good question. The capacity is generally determined by the fire marshal's office, and you sometimes see that posted, but it doesn't always reflect the actual seating in the restaurant, which can be reconfigured as we learned during COVID and the restrictions there, but as restaurants determine. And so we thought that that was a better way, because it's those customers who are actually seated and spending significant time in the restaurant. And we thought that was more appropriate for purposes of this bill versus the fire marshal's determination of capacity, which could also include employees back in the kitchen.
Delegate White, did you have a follow-up?
Yeah, so I mean, and Delegate back, Madam Chair, to your earlier point, I mean, this is not just for those who are patrons, but it's also for the employees. So in factoring that in, recognizing that this relates to seating capacity, as far as how we determine where these would be placed, how are we including employees in that larger configuration, given that response?
And if you'll indulge me, Madam Vice Chair, I can speak to this a little bit. That was actually part of the discussion around not amending to indoor only, because not only when you have outdoor seating do you have more people, but you have more staff. And so that was trying to strike that balance and recognize that that we need to account for the safety and well-being of the employees as well as the patrons. Delegate Hutchinson.
Thank you, Madam Chair. I just wanted to go on record and note that I am not in favor of the amendment because of the outside seating capacity being excluded from, or included, I guess, in the amendment. Thank you.
Thank you. We'll make sure we record that accordingly. Thank you. Delegate Alston.
Thank you, Madam Chair. I'm just wondering, I heard from the Restaurant Association just now that even with the amendment, they're not still in support of the bill. So I'm wondering, what are we gaining from these changes? The people who are opposed to it, some of them are going to just be philosophically opposed to a mandate. So who are we picking up with in terms of support and votes by increasing the grocery store to $10 million and increasing the restaurant from 400,000 to 1 million? Like, what additional votes are we gaining by doing this? I just don't see why we can't do what was originally proposed and still pass the bill. The people who don't like it fundamentally are still going to not like it. And so I just think we should pass what was originally contemplated, because I just don't see where we're gaining anything that we wouldn't have already had with the original makeup of the bill. And to the point of taxes and affordability, even with a 3% profit margin on $1 million, you're talking about less than 0.025 of the actual profit that would be spent on this machine. So this whole crying about it's not affordable, it's just not based in reality or mathematics.
Madam Vice Chair, do you want to respond?
I think I'm just going to go back to the way that we typically work in health and government operations, which is to try to get folks to at least a point of being able to live with. That means those who are most affected by our policy, that we try to get them to a point where they can say, well, I don't like it, but I can live with it, and I can live with it under these circumstances. And we try to move forward. Sometimes it's in small increments, and sometimes we can do bigger increments, although I found those big increments a little rare, but we know that we can try to move forward. And if we have information in a year and a half from now that says that 3 lives were saved in restaurants in this 18-month period because there were AEDs there, I think that's going to be very powerful information for us to consider how to expand the policy. So I guess I would just ask for indulgence and patience in terms of how we approach the process and trying to bring again, it's the folks who are most affected by the bill on board to the extent we can. Thank you, Madam Chair.
Thank you, Madam Vice Chair. Delegate Hutchinson for the, final comments. And then we need to take a vote. Oh, your hand is not raised. Okay. So on the bill as amended.
Move the bill as amended.
Second.
All right. Any further discussion? We've had a really good, robust discussion. So all in favor, say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. So I have Delegate Hutchinson, Delegate Chisholm, Delegate Riley. All right, the bill passes, not unanimous. So this is on both the Senate Bill 299, and then we will also, we have possession of the House bill, Erin? Yes, okay.
Yes, we do.
And House Bill 288. And Delegate Hutchinson, your hand is still up. Is that just, okay, no problem. All right, then with that, can I have a motion to adjourn?
So moved.
Second.
All right, thank you very much for all your hard work and this discussion.